My name is Dr. Anand Bery, and I'm a neurologist and otoneurologist at Mass Eye and Ear. My field spans neurology and otolaryngology, and I see patients who have dizziness, vertigo, and vestibular disorders. This includes patients who have conditions like benign paroxysmal positional vertigo, or BPPV, vestibular neuritis, vestibular migraine, and other causes of dizziness like chronic dizziness. Patients who come to see me in my clinic have often seen other providers and are looking for a subspecialty opinion. We're very lucky at Mass Eye and Ear to have a formal vestibular lab where we can test patients' vestibular function and help give them some insight into why they might be having dizziness, vertigo, or imbalance. My research at Mass Eye and Ear spans three broad themes. The first is understanding how we're diagnosing patients with dizziness and trying to improve that process, particularly in frontline settings, including primary care offices and the emergency department. We often see patients months after diagnosis, after they've seen many providers, and our goal is to take our very niche subspecialty expertise and try to translate it to providers who see the patients closer to the onset of their symptoms. The second area of my research centers on understanding the transition between acute and chronic dizziness. I seek to understand why some patients with acute dizziness are able to turn around more quickly and why some patients with acute dizziness progress into a more chronic state. Specifically, we're trying to understand risk factors and other conditions that might lead for a transition from acute to chronic dizziness. As an example, our work has recently shown that sleep disorders, and particularly sleep apnea, is one factor that might lead from a transition from acute to chronic dizziness. Lastly, I'm very interested in the patient experience, understanding more about what our patients are looking for when they come to our clinic, what they're expecting from us in terms of diagnosis, treatment, and what their views are in terms of quality of life in dealing with chronic dizziness. I did my undergraduate degree in neuroscience at McGill University. I then did medical school at the University of Toronto. I did adult neurology training at the University of Ottawa, and then completed a fellowship in vestibular neurology and ocular motor otoneurology at the Johns Hopkins School of Medicine. I grew up in Toronto, Canada, so I really enjoy being in a place that has 4 true seasons, just like Boston. In my spare time, I like to play tennis and golf and to ski in the winter.